welcome to the download. I am Tabitha Saris with the St. Louis Regional Chamber, and today I'm very excited to have Yvonne Buhlinger with the Affinia Healthcare Foundation. She is their Executive Vice President. Welcome, Yvonne.
Welcome. Well, thank you so much for having me on the download. I'm really excited to be part of this program and share resources, information, and really a call to action to the community as well.
Can you tell us a little bit about Affinia Healthcare and about Affinia Healthcare Foundation?
Yes, certainly. So Affinia Healthcare is a non-for-profit. It's a community health center, and Affinia Healthcare has been part of the St. Louis community since 1906. We've changed our name a few times throughout our history due to whatever is happening in the socioeconomic environment. However, we have been Affinia Healthcare as far as our name now for 5 years. And we have a foundation so that through that resource, and the foundation is much newer, it's now about 2.5 years old. Through that foundation, we can enlist resources to support the work of our community health center. Through the community health center services, we provide care, healthcare in terms of medical, dental, behavioral health to 43,750 individual patients per year. So we're kind of that well-kept secret. Unfortunately, you never want to be a secret, but not to 43,000 people. They know us very well. Some of our patients have been our patients generationally. Some are newer people to the community, a lot of immigrants, for example, that we serve. So we have a mix of new and ongoing patients. And these are individuals who, for the most part, about 90% of them have incomes under 100% of the federal poverty level. So it's a critical mission, and this is why we also have a foundation, as we need resources and support from the community at large so that we can go on with that mission of caring that we've had since 1906.
It's amazing. It is absolutely amazing what Affinia is doing now. And you have several locations conveniently located throughout St. Louis. So you're very easily accessible for your patients as well and the community.
Yeah, we have always had as part of our strategy to ensure that we're accessible to the most under-resourced sections of the community. So our locations are, most of them, we have 12 locations, and 10 of them are located along the, in the city, east of Grand sort of corridor, and a couple of them are in North St. Louis County. Several of the locations are within schools, so school-based services to make services very accessible to children and teens, and help families to have less barriers to care for the health of their children, whether that is medical or behavioral health and dental. We also have mobile medical and dental for children. So we have a wide breadth of services, and that's how we reach these 43,000 individuals that we care for. And this is our passion, is to meet the needs of the community.
It is amazing, absolutely amazing. But we'll put all of that information in the blog post so people can connect with you. So Yvonne, can you share with us some of the, and Affinia is doing amazing things in the community, but can you just give us a small snippet of some of the collaboration that you may have seen within the community?
Yes, absolutely. So currently, as everyone knows, with the COVID-19 pandemic, we have urgent matters here in our region. So Affinia Healthcare immediately recognized that the under-resourced communities would really be at highest risk. And that is where we rallied community partners and contacted funders. And in return, because we have a great deal of trust by funding entities and partners and government entities, we were also tapped. So it was kind of a two-way street where we were able to really create a well-rounded resource to launch COVID-19 testing, drive-up and walk-up testing services in the under-resourced areas that we provide services in. And so we were the first entity to provide drive-up and walk-up testing in North St. Louis City. And that first location we launched on April 2nd, which is very accessible for individuals who are unhoused, as that location is closest to the Biddle House, which is a very large homeless shelter, and a lot of other people in the community who can easily access that particular location. And then we were also the first entity to launch a drive-up, walk-up testing location in South St. Louis City. And now we have 5 drive-up, walk-up testing locations in St. Louis City and St. Louis County as well. Some of those are through special collaborations, such as with Beyond Housing, Better Family Life, and mobile testing, which we were also able to put in place due to collaboration. And this is with the Missouri Department of Health and Senior Services through their Office of Minority Health. And with that particular mobile service, we've been able to really extend that reach of collaboration to other partners. Like today, we were at the International Institute providing testing for refugees and really anyone in the community who needs it. Also collaboration with the NAACP, the Urban League, and many others. And also we've been the fortunate recipient of a lot of help so that we can do this testing effectively and really help people effectively. And that was, for example, assistance through the St. Louis Fashion Fund with masks for our staff, assistance by the St. Louis Face Shield Initiative and the makers, the community of makers, which is amazing. We have been just so very fortunate to have their support. I'm trying to remember the names of some of the companies, and I'm sorry that I'm kind of blanking out right now, but there's been so many. And also the Hispanic Chamber of Commerce, they have a foundation, and through that foundation, they have been supporting our efforts through a lot of meals, as they also support some of the minority owned restaurants and small businesses in the area. So it's been a real win-win where people are coming forth to provide support to our activities, and in turn, those activities really help the whole community. We want to keep the community safe, healthy, and help us all get back on our feet to work and school and life.
I love it. You're the heart of our community, and
I think that's how we see it as well. You know, knowing that we touch so many lives is a great responsibility, and keeping people healthy, we have seen how vital, how important that is. Sometimes we take health for granted, but certain things such as preventive healthcare services, they're kind of hard messages to get across as something to embrace as a mission, because so much is taken for granted until somebody has an issue. So things like screening for doing cancer screenings, that's something that we do day in and day out, and bring that service to under-resourced, underserved individuals, people who are underserved in other ways, or even prenatal care. And there's other crises that go on simultaneously that, unless they touch your life, if you have you're in good health, your family's in good health, you may not know. But the opioid crisis, that is a little bit more out there in the news. People do hear about it with the COVID-19 pandemic, that the news in that regard seem a little quieter, but we're seeing a spike in the deaths because of opioid overdose in our region. And for that reason, we are offering free Narcan at all of our COVID stations and all of our locations right now. And that is, again, a collaboration. That is a partnership with the company that is offering the Narcan. So yeah, it's an urgent issue, and substance use disorders is a great problem in our region, and that is a service that we provide.
Glad that you brought that up, because a lot of people are so laser focused on COVID, they don't really take into consideration that the other issues that we had during that time, and how to help people. Yep. How do we do that? So thank you for bringing that up. Yvonne, if people want to help Affinia, if they want to contribute in some way, shape, or form, what do you recommend? What's the call to action?
Well, I see, a number of things and a number of ways to help. So the one that is always available if people want to help is to go to our website and make a donation. So that's an ongoing need, not only to meet current and pressing needs that are immediate, but really the donations through our foundation that help to build I'm going to be repetitive here, a foundation for support to many of our services that really give us a springboard for growth and sustainability to a lot of our work. So donations are really key. This is how we can keep moving forward and keep our mission strong. Other ways to help, we are doing a blood drive. We did this yesterday at one of our locations, and we're doing it again on Friday the 29th. And anybody who wants to donate blood, this is a collaboration between the Red Cross and Grace Hill Settlement House and Affinia Healthcare. So we invite the whole community to jump in. You do have to go to the Red Cross website. It is redcrossblood.org is where you really need to go. And then on the search box, you type the word Affinia Healthcare, all one word, and that will tell you, that immediately will pop the window where you can go and give blood. So that's a part of our COVID response to the region. In addition to that, we need face masks. And our staff, for the most part, we can provide that safety for our staff. And we've received, like I mentioned, the St. Louis Fashion Fund, face masks for our staff, but we need them for our patients. And we need about 200 to 300 masks per day. If you recall, in the beginning of the conversation, I mentioned we serve 43,000 patients, and daily we're doing a lot of testing along with providing a lot of other healthcare services. So we need the face mask because our patients are, most of them do not have the resources to be able to get on the internet with a credit card and pay for masks to be shipped to them, or how do you get a face mask right now? They don't have sewing machines, they don't have the materials, they don't have a way to really do it. So when we can provide face masks, it's something that immediately helps increase the safety of that person and the people they associate with. So we're keeping the whole community safer when people have things like hand sanitizer and face masks. So that's another call to action. So people who can donate in that way, they can contact me. We can figure out where to drop off or pick up, and that would be a great help.
I love it. Well, we're going to put all of this information in the post, as well as all of the links that you referenced. Well, thank you so much, Yvonne. You were full of wonderful information. And if you have face masks, please donate them to Affinia Healthcare or get in touch with Yvonne. We'll have all of her contact information on the blog post. Thank you, Yvonne. We appreciate your time.
We appreciate the invitation and the support by the St. Louis Regional Chamber. Your support is really essential as we are able to get the word out to the community of the help that we need, and that also helps the community. We appreciate it.
Thank you.
Thank you.
All right, hold on.